So one by one we'll see these foraminas, the incisive, the greater palatine, all these foraminas we are going to see one by one. And I forgot to mention carotid canal in Norma Basalis externally. And you can see here, this is the area of carotid canal seen on the inferior aspect of the petrous temporal bone. And I think rest I have covered most of the things. So vomerovaginal canal, palatovaginal canal, not discussing, not of much significance for you. The most important are these. And okay, one thing which I forgot to mention was the extradural hemorrhage in the area of the pterion. If somebody meets road traffic accident or someone hurts with a log at the area of pterion, so the anterior division of the middle meningeal artery is going to bleed here, and the blood will collect outside the dura mater and on inner side of the cranium. So this blood is going to compress this area of brain, and it may even lead to death or unconsciousness. So what do you have to do? You have to release the pressure by trephination or craniotomy. You will make a hole and release the blood from here. So this point I forgot to mention. And one more thing which I should have talked about was the attachment on the pterygoid plate. So there were two pterygoid plates, the medial pterygoid plate, the lateral pterygoid plate. So the lateral pterygoid plate is the important one, which gives attachment to the lower head of the lateral pterygoid muscle. So this is the lateral pterygoid muscle. Here must be the lateral surface of the lateral pterygoid muscle. So the lower head of the lateral pterygoid muscle is attaching here, and you will see the deep head of the medial pterygoid is also attaching to the medial surface of the lateral pterygoid plate. So basically the lateral pterygoid plate is the muscular plate. Now medial pterygoid plate basically is pterygoid humulus is part of it, so superior constrictor is attaching here. So many other things are also present here, but I am only discussing the most important ones. Now, one by one, we are going to see the foraminas on the Norma Basalis on the external aspect. First is the incisive foramen. So here is the incisive foramen, the greater and lesser palatine foramen. You can see the greater and the lesser palatine foramen. So what passes to the greater palatine foramen? The greater palatine nerves and vessels. So you can see the greater palatine nerve, the greater palatine vessels. So this is branch of maxillary artery here you see, and the terminal part of the greater palatine vessel is passing through the incisive foramen. You can see here the terminal part, and the nerve which is passing from nose to palate, it is coming from nose towards the palate, is the nasopalatine nerve. So you can see here, if someone asks, is the terminal part of the greater palatine vessels from palate to nose, and the terminal part of the nasopalatine nerve from nose to palate. So this passes through incisive foramen. The greater palatine nerves and vessels from greater palatine foramen. What passes through the lesser palatine foramina? The middle and posterior palatine nerves pass through the lesser palatine foramen. So lateral palatine arteries also pass through the lesser palatine foramen. Now foramen ovale, the mnemonic you all know is male. What represents the M? What is M here? This is the mandibular nerve. You will see this is the trigeminal ganglion. It is giving ophthalmic division, maxillary division. The mandibular division is passing through this foramen ovale, and this will come and divide into anterior, posterior division. All these things we are not discussing here. The only thing which you are going to see is this mandibular nerve passing through foramen ovale. Beside that, the accessory meningeal artery, the lesser petrosal nerve, the emissary vein which are connecting the cavernous sinus with the pterygoid plexus of veins are also passing. Sometimes you will see the anterior trunk of middle meningeal vein may pass from this foramen. So this is the most important foramen among all. Now the foramen spinosum. So foramen spinosum basically give passage to the middle meningeal artery. So this is your middle meningeal artery, and it is branch of first part of the maxillary artery, and it will be rising somewhere here and will be passing inside the cranium through this foramen spinosum. Now you can see very important relation. The middle meningeal artery, when going to enter in foramen spinosum, is related to two roots of auriculotemporal nerve, and it is passing behind mandibular nerve. So these few relations are very commonly asked here, but the most important is what passes through foramen spinosum is the middle meningeal artery, the nervous spinosum. Okay, so the nervous spinosum is a branch of mandibular nerve. Now coming on to the spine of sphenoid, it is very important because medially eustachian tube, cartilaginous part of eustachian tube is related to sphenoid, spine of sphenoid, and laterally the chorda tympani nerve. And you will see medially these two, eustachian tube, the cartilaginous part, the chorda tympani, and the laterally auriculotemporal nerve is related to the spine of sphenoid. If fracture or some damage to spine happens, there will be decreased salivation and loss of taste of sensation. So chorda tympani related to loss of taste sensation, and auriculotemporal salivation, you have seen this in parotid. So the decreased salivation is part of it. Now ligaments attached is sphenomandibular ligament and anterior ligament of malleus and pterygospinous ligament. So three ligaments attached to the spine of sphenoid, two muscles, the tensor velli palatai and the tensor tympani muscles attached to the spine of sphenoid. This is commonly asked in viva. Now the very important foramen is foramen lacerum. So basically this foramen lacerum, during the life, the lower part of the foramen is filled with cartilage and no significant structure is passing. But you see, however, the upper part of foramen you will see is traversed by internal carotid artery. So you can see this, the upper part, in upper part it is traversing, you will see it is entering to the cranial cavity through the carotid canal, and it will pass within the petrous temporal bone and will come to the apex of the petrous temporal bone and will be traversing in upper part of the foramen levering. I'm not saying it is passing, it is traversing along with the sympathetic plexus around it and the venous plexus around it. Now one more thing which you will see in anterior part, which is also not passing through and through but traversing, is the deep petrosal nerve joining the greater petrosal nerve, forming the Vidian nerves, which is passing in anterior part of this foramen lacerum, and this is nerve to pterygoid canal or Vidian's nerve connecting to pterygopalatine ganglion. So what actually passes through is meningeal branch of ascending pharyngeal artery and this emissary vein, which is connecting the cavernous sinus with the pterygoid venous plexus. These two things are actually passing, and these arteries and the deep petrosal, greater petrosal joining here to form the Vidian's nerve are actually traversing. So this is upper part of the foramen lacerum, this is the anterior part of foramen lacerum, and okay, not going into detail. Now what passes through carotid canal? You see the internal carotid artery and sympathetic and venous plexus around internal carotid artery pass through. So can you understand this diagram? This is the petrous temporal bone. This is inferior aspect of the petrous temporal bone where we saw this carotid canal. Now the external carotid will come, it will divide into common carotid will come, external carotid will go towards the face and neck, and everything is being supplied here. Now internal carotid will enter into the carotid canal, will pass to petrous temporal bone, will traverse above the foramen lacerum, will pass in the cavernous sinus here, and then is going to form the circle of Willis here. So we'll see later in brain part also. So here you have to remember the carotid canal, which is giving passage to internal carotid artery along with venous and sympathetic plexus around it. Now the foramen magnum, very important. So it has been divided into two parts, the anterior compartment, the posterior compartment. Now the narrow anterior compartment is giving mainly passage to the ligaments. So this is your narrow anterior part, giving to the passage to apical ligament, cruciate ligament, and membrana tectoria. Now through posterior part, which is quite wide, you will see through the wide posterior part, lower part, the medulla oblongata along with its three meninges. So this is your pia mater, the purple color, the green is arachnoid matter, and this is the dura mater. Along with its three meninges, the lower part of the medulla oblongata is passing in posterior wide part. Now in subarachnoid space between the arachnoid and pia mater. This area is the subarachnoid space. Here you will see the posterior spinal arteries are passing, vertebral arteries are passing, and one anterior spinal artery. Posterior you will see two spinal part of accessory nerve like spinal nerves are passing here. So basically this you have to remember, there is one spinal artery, one anterior spinal artery, and there is one vein, spinal vein, and the rest are paired. So this is very important, you should practice this diagram again and again. Now coming on to the hypoglossal canal. Before that we move to the jugular foramen, which is more important. So jugular foramen is basically, here you will see it is divided into anterior part. This is your anterior part, and here you will see this is inferior petrosal sinus is passing, this IPS, and the meningeal branches of ascending pharyngeal artery is passing here. Now you will see the 9th, 10th and 11th nerves are passing through the anterior part. Now through posterior part of the jugular foramen is passing the internal jugular vein along with the occipital meningeal branch of the occipital artery. So this is very important foramen, quite frequently asked in exam. So you can see IPS and APA, the 9th, 10th, 11th, and internal jugular vein and meningeal branch of occipital artery. So coming on to the hypoglossal canal, also known as anterior condyle canal. Here you can see this is the area seen from interior of the skull, because Norma Basalis was not able to show you that angle. So this is the area where this through and through will pass and will be seen in Norma Basalis as well. This is the hypoglossal nerve. Along with that, meningeal branches of hypoglossal nerves will pass, meningeal branch of ascending pharyngeal arteries will pass, but best is you remember hypoglossal nerve. Now stylomastoid foramen is giving passage to the, when a facial nerve is taking exit from the cranial cavity, it takes exit from this stylomastoid foramen between styloid process and mastoid process, and this facial nerve and stylomastoid branch of posterior auricular artery is passing from this foramen. Now coming on to the newborn skull. If any foramen left, I will cover it in next class when I will be teaching the interior of the cranium, and basically only few foramen will be added in interior, so I'll discuss in next class. So in newborn skull you will see there is one very striking feature which you can see that the cranium is of huge size, but the facial skeleton, because there is absence of teeth here, the fetus is not masticating, so these jaw teeth are not required, so that's why this area is quite small. So this neurocranium looks quite big, and because of fast development of cranium, this neurocranium is quite large. What is significant here is fontanelles. So this is anterior fontanelle. Yeah, you will see total 6 fontanelle in relation to the parietal bone. So this whole bone is parietal bone. From one side you can see this is anterior angle, this is posterior angle, and here this is anterior inferior, posterior inferior angle. So and similarly on other side, total 6 fontanelle. This is anterior fontanelle, this is posterior fontanelle, this is anterior inferior or sphenoidal fontanelle, this is posterior inferior or the mastoid fontanelle. Now you will see the only fontanelle which you get to see up to the age of 2 years is anterior fontanelle, and it will close, this posterior fontanelle will close by 3 to 6 months, and rest also close before 2 years. So only the largest diamond shaped fontanelle which remains for quite longer time is this, that is the 2 years of age. This is anterior fontanelle. So this is anterolateral and posterolateral, other names for sphenoid fontanelles are. So I think we are covering most of the parts here. The mandible and the interior of the skull will be dealt in next class. Thanks for watching.